Hello there, welcome to another episode of the She Health series. My name is Dr. Sida Ikanem, and this is my social impact project under the auspices of Excellence in Medicine Ladies Network and Medical Women Association of Nigeria Lagos chapter. In this video, I'm going to be talking about toilet infections versus sexually transmitted infections, or otherwise called STIs. Did you know that each year about 300 million new cases of sexually transmitted infections or STIs are reported? And in fact, in a study done in the US, about 19 million young people between the ages of 15 to 24 years were reported to have had sexually transmitted infections alone in 1 year. That goes to show that sexually transmitted infections are of public health importance and therefore we must talk about it. If this video sounds like something you would like to know, I want you to do something. First of all, like this video, share, and stick around for more. Thank you for staying tuned in. Now to the topic of today, toilet infections versus sexually transmitted infections. I have made a video before comparing toilet infections as versus urinary tract infections or UTIs. Usually, people use toilet infections to describe a certain group of symptoms that include pain during urination, low abdominal pain, abnormal vaginal discharge, and I have made myself clear in that video that there's no such thing as toilet infections. Now, let's look at toilet infections in the light of sexually transmitted infections. A study was done in Obafemi Awolowo University Teaching Hospital by Oripesolaye and Olasode, and they found out that about 91% of respondents to have had symptoms they describe as toilet infection, when in fact they actually had sexually transmitted infections, and they believed that this infection was gotten from the toilet. About 88% of them also believed that these symptoms had nothing to do with sexually transmitted infections. This goes to show how people are really misinformed when it comes to symptoms, pertaining to the sexual or reproductive tract. Now, sexually transmitted infections, as the name implies, just refer to set of symptoms or infections that are transmitted during sexual intercourse. There are two broad categories of sexually transmitted infections. The first is called discharging sexually transmitted infections, and the next is called ulcerative sexually transmitted infections. As the name implies, for sexually transmitted infection described as discharging, it means that the main symptom would be abnormal vaginal discharge. Also, other symptoms could include low abdominal pain, pain during sexual intercourse, abnormal bleeding, fever, body aches, or generally fatigue, depending on the extent of infection. Now, for ulcerative sexually transmitted infections, the major symptoms will be the formation of ulcers, and usually these ulcers, depending on the causative organism, could appear in different sizes or forms. What are the examples of discharging sexually transmitted infection? Examples of discharging sexually transmitted infections include chlamydia, gonorrhea, another is mycoplasma, and trichomoniasis. I know these names are very big names, but generally, discharging sexually transmitted infections will just show like discharge, abnormal vaginal discharge, usually foul smelling. It could have a yellow color. It could be frothy and just very copious. An excessive amount of discharge, because circumstances the vagina has its normal regular vaginal discharge, but when this discharge becomes excess, it becomes foul smelling, it has a different odor, then we know that this is a sexually transmitted infection. Now, examples of ulcerative sexually transmitted infections. These are infections whose main symptom is ulcers. Ulcers could also be accompanied by changes in the color of the skin, pain in the genital area, pain during urination, pain during sexual intercourse as well. These examples include herpes, which a lot of us know. The next is syphilis. The next one is called LGV chlamydia, another kind of chlamydia infection. And another one is Klebsiella granuloma. These are very big names, but it's good for you to know them so that you can stay informed and make the right choices concerning your sexual and reproductive health. I'm going to look at the symptoms of sexually transmitted infections. They include fever, abnormal vaginal discharge, pain during urination, ulcers, pain during sexual intercourse, fever, myalgia, that is another way to say muscle aches and pains. Also, Depending on the type of sexually transmitted infections, there could be eye changes, skin changes, and even weight loss if the sexually transmitted infections are coexisting with human human immune deficiency virus, or commonly called HIV. You see, sexually transmitted infections, STIs, are of really public health importance because of its consequences and its complications. What are the complications of sexually transmitted infection? First and foremost, one of the complications is infertility, top of the list. Because this sexually transmitted infection causes inflammation of the reproductive tract, it disrupts the mechanism of transport of the female eggs to meet the male sperm. And this is why most women who have or have had sexually transmitted infections in the past that were untreated come down with blocked tubes. I'm sure we have heard about that before, which is one common cause of infertility. Another complication of sexually transmitted infection is chronic pelvic pain or pain during sexual intercourse. Now, for depending on the type of sexually transmitted infections, in terms of syphilis, it can be so severe that syphilis can result in some brain damage, usually referred to as neurosyphilis. Now, because of how easy it is for sexually transmitted infections to be transmitted from one person to the other, it's very important to always take precaution when it comes to your sexual and reproductive health. The first one is abstinence. If you're not ready to engage in sexual intercourse, by all means, you have to avoid it until when you're ready, probably in a stable relationship or in a marriage. The next thing is that um, you want to reduce or have a stable sexual partner. Avoid multiple sexual partners. It is wrong. The next thing you want to know, always know the status of your sexual partner is very important. Make sure he or she is screened for sexually transmitted infections. The fourth thing is to make sure you use protection during sexual intercourse. The common one is condom, which is readily available. Let me just say this at this point. Yes, sexually transmitted infections are transmitted sexually. Condoms have been found to reduce the incidence of sexually transmitted infections. But however, there are some sexually transmitted infections that can be transmitted through skin contact. And in this sense, condom alone will not cut it. One example of this sexual transmitted infection is the human papilloma virus, which is known to be transmitted through skin contact. So you can see generally that even though condom has been proven to be helpful, it also has its own lapses when it comes to sexually transmitted infections transmitted through skin contact. Now, why do people call sexually transmitted infections toilet infections? It is still simple because these symptoms of sexually transmitted infections will usually be experienced when people need to use the restroom. Painful urination, discharge, lower abdominal pain, back pain, depending on the type of sexually transmitted infection. Because toilet infections or toilet disease is a misnomer, it therefore means that there's usually misbehavior when people have this mindset. Because one, they play down on the importance of the symptoms they are having, and because of that, they do not seek care in time or they self medicate. It is therefore important that if you have symptoms that I have previously mentioned, and I'm going to mention them again, make sure you do well to see your doctor on time and get treated so that you can preserve your fertility potential. The symptoms are abnormal vaginal discharge, ulcers around the genital area, pain at the genital area, fever, painful sexual intercourse, low back pain, skin rashes, or even weight loss. Make sure you do well to see your doctor. It will interest you to know that one of the sexually transmitted infections, human papilloma virus, has been linked to the incidence of cervical cancer. That is why it is usually advised that women get vaccinated against human papilloma virus to reduce their chances of developing cervical cancer later in life. Sexually transmitted infections affects the quality of life of women globally. 300 million cases of sexually transmitted infections. It is usually an embarrassing topic, so most people are not willing to talk about it, and that's why I'm here. I want you to do the following to make sure you take care for your sexual and reproductive health. Number 1, abstain from sex. 2, get tested. 3, practice safe sex. Number 4, avoid multiple sexual partners. And number 5, stay faithful to your partner. Thank you for coming to the end of this video. If you found it helpful, I want you to do the following. Leave a thumbs up, drop a comment, subscribe to this channel, and share this video to someone who you know would need it. And this is the end of our She Health series. I hope you've had an amazing time so far. I will still be making more videos to talk about all things female and reproductive health, and I want you to stick around. Dr. Sita cares. Bye.